Greetings, this is Dr. Sandra Cabot talking to you about osteoporosis, what you can do to treat and prevent osteoporosis. And in this video, which is my second video out of 3 on osteoporosis, we're looking at some of the natural treatments to build your bone density. Let's start with vitamin D. We've all heard of vitamin D. Now, vitamin D3 is made in large amounts from cholesterol in your skin when your skin is exposed to the sun. Interestingly, vitamin D is actually a steroid hormone and not really a vitamin. In addition to skin manufacture from sunlight, vitamin D can be found in some animal foods. It is also available in supplement form, with the current recommendation being that you take between 400 and 1,000 international units of vitamin D3 daily. Many people, especially those who avoid the sun or those living in cold countries, need much more than this, and doses of around 5,000 international units daily may be needed before you can get your blood levels of vitamin D into the higher desirable range. Regardless of how you get it, make sure that you have an adequate amount of vitamin D in your body, or your parathyroid hormone will go up too high and leach precious calcium out of your bones. This can also cause kidney stones. You can ask your doctor to check your blood level of parathyroid hormone and vitamin D, and this is very accurate. Vitamin D can be measured in 2 different units of measurement. In the United States of America, the units used are nanograms per mil. In Australia and Canada, the units of measurement are nanomoles per litre. The normal ranges of vitamin D for blood tests reported by different laboratories and countries vary significantly, and you will be surprised by the large spread in the so-called normal range between its lower and upper limits. You don't want to be average here. You want to have levels of vitamin D that optimize strong bones. The optimal levels of vitamin D are higher than the average levels. Also, you only want to supplement with natural vitamin D3, which is human vitamin D. The synthetic and inferior vitamin D2 does not work as well as D3. The synthetic vitamin D used to fortify foods is vitamin D2, known as ergocalciferol. It is used to fortify many foods and drinks. Vitamin D2 is also found in vegan foods such as mushrooms, various algae such as spirulina, chlorella, and blue-green algae, and dark green leafy vegetables, but not in adequate amounts to satisfy human needs. The other form of vitamin D, known as cholecalciferol, is vitamin D3, which is the kind of vitamin D your body produces as a result of sun exposure, and is also found in some non-vegan foods, including egg yolks, butter, and oily fish like mackerel, salmon, sardines, and herring. I recommend you take enough supplements of vitamin D3 and or get enough sunshine to keep your blood vitamin D levels around 150 to 200 nanomoles per litre, or 70 to 80 nanograms per litre. Excess vitamin D intake can cause elevated blood calcium levels, So don't overdose on vitamin D. It's not a case of the more the better. Rather, get your blood level checked every 6 to 12 months to find the dose of vitamin D3 that keeps you in the optimal levels. Now let's look at vitamin K. Vitamin K is extremely important for those with low bone density, as it works in concert with vitamin D3 to remineralize the bones. Vitamin D is required to absorb calcium from the intestines and to put calcium into your bones. However, the calcium needs to be integrated and spread throughout the bones in the correct places, and this is what vitamin K can do. Vitamin K improves the architecture and strength of the whole bone. As a side tip, let me tell you that vitamin K often helps people with vertigo for the same reason, because it puts the minerals in the right place in your inner ear. So remember that as a useful tip. If you suffer with vertigo, it can often be fixed with a supplement containing vitamin K and vitamin D. So let's look at what should you eat to prevent osteoporosis. Ensure you consume adequate minerals. Calcium is not the only mineral needed for a strong skeleton. We need magnesium, calcium, manganese, zinc, silica, boron, and copper. These are all essential. Dairy products such as milk, yogurt, and cheese are a source of calcium. Not everyone is able to digest dairy products well, or they can aggravate some immune system conditions. A2 milk, raw milk, goat or sheep dairy products are an option for some people. Non-dairy foods high in calcium and other minerals include tinned fish, including the bones, broccoli, bok choy, raw nuts and seeds, tahini, hummus, and seaweed. Try to consume foods high in vitamin K. Many people don't get sufficient vitamin K2. K2 is the form of vitamin K that is most important for the bones and puts calcium into the bones and reduces the deposition of calcium in the arteries where you don't want calcium to build up. The fermented soy food known as natto has the highest vitamin K2 levels of any food. However, it is an acquired taste and is not always available to purchase for many people. Beef and lamb liver are high in vitamin K2 and are healthy to eat. Oily fish, mouldy cheese, and egg yolks also contain vitamin K2. Leafy green vegetables contain vitamin K1, and our good gut bugs can convert vitamin K1 into vitamin K2. But people with poor gut health may lack these beneficial microbes. Try to consume foods high in vitamin D because it enables calcium absorption from the intestines. A few foods contain vitamin D, including oily fish, egg yolks, cod liver, full-fat dairy products, and the fat on meat. Also, protein is very important for strong bones, and try to consume adequate protein-rich foods such as meat, seafood, poultry, and eggs, which all help to provide your body with the building blocks for all types of protein synthesis, including collagen. Your bones need plenty of good quality protein to be strong. So that's the end of this video on foods and natural supplements to build your bone density. And in my next video on osteoporosis, I'll be looking at supplements and prescribed medications to increase bone density. So thanks for listening, and if you've enjoyed this video, please share it, click like and subscribe. Thanks for listening.